So I would like to ask Dr. Anirban sir the next questions. Dr. Anirban sir, can you please explain us about what are the most important points which should be noted so that our topic or proposal gets selected?
Very good point. Thank you, Dr. Parag, sir. You have mentioned hello.
Yes, I already.
Yes, yes. Okay. So you have explained it elaborately and the most important points have been highlighted already. So I just want to mention few things before going to your exact question. The technical points, the technical things in the ICMR and the ICMR people, how they are going to select these things. These things should be remembered. These things should be kept in mind before going to submit your proposal. So I'm just going to mention few points like the students, they can choose any of their topic related to biomedical research, and they can work under any guide from his or her college. But ICMR doesn't provide any additional funds than these 550,000. So this should be kept in mind. And second is the most important, the proposal that are received from the students are on varying topics, not that is particular topics like public health, not from the medicine, not from surgery like that, not from the anatomy itself. So there are several topics, several subjects of study uh, questions are coming out. So it is possible that the topic of research may not exactly match that the subject qualifications or the expertise of the reviewers or the scientists, but they are requested to kindly focus on the research aspects and the methodology and the complete the review. So why I'm asking that, why I'm repeating these things, because you need to focus on the methodology part. Dr. Parag sir already mentioned about that, that methodology should be very precise, very complex, very much compact in the form. The next is in generally we are getting the more than 4,000, 5,000 proposals every year, and each proposal has an approximate word limit of 1,500 words, that is almost 4 or 5 pages. So the students may also submit the study questionnaire, case records form as a separate file. So this is a huge load. So if you need to focus on how your proposal will get selected, you need to give stress on some particular areas so that this topic can be catchy, or this your proposal will get selected easily without making such complications. The most another most important is that each application is actually evaluated by three reviewers: one from administrative reviewer and two from the research scientist reviewer. So after this research scientist reviewer, the administrative reviewer will look into the feasibility of the study. Whatever already Dr. Parag Chavda has mentioned, that feasibility within 2 months with this amount of 50,000, you can bear this kind of study, you can undergo this kind of study. So this should be kept in mind. And there is a provision to declare this conflict of interest in the regard of evaluation of STS proposal. And this your review, the scientific review, it will actually it will be done within 10 to 15 days. So you will get the result by April, mid of the April or early in the April. This is the I'm just giving you this brief ideation of that. So now, Venkatesh, I'm going to your question, that what is the priority area for the submission. The priority area should be, I have just enumerated in four to five categories. First of all, this study should be very much unique in the sense of not according to your textbook. That is that I'm just giving importance on this unique cases. Like there are this kind of studies may have been done in several other setups, but should be done in your setup first from your point of view. And the second thing is the authorized protocolized things should not be there, that is given in your normal textbooks. So this should be the study title or the idea should be little bit unique. You need to follow all the steps mentioned in your ICMR criteria pages that is given in your website. Methodology should be very much appropriate and to the point so that no questions can be come out from this point. And the third and the last one is the plagiarism should be avoided. What is plagiarism? You should not copy from one paper and just paste it in your proposal, so that when you are going to find out the plagiarism, will get that your proposal has been copied from these articles or those articles, like that. So then the rejection chance will be higher. So next, I must mention this where are the point we should emphasize more for the selection. So I need to mention that scoring pattern. Venkatesh, if you allow me, I must say that the scoring should be within 100 marks, and in these 100 marks, the introduction will give the 15 marks, the objectives will give you 20 marks, methodology is 30 marks, implication is 15 marks, and new idea of research is 10 marks, and references in 10 marks. So again, you get the thing, my point, that is methodology is getting 30 marks. So if you are very much neat and clean and to the point in methodology, you can easily crack your STS. So next thing, I just want to share my screen so that it will be very much helpful for all of you. Is it visible? No, sorry.
Not yet. Yes, sir, it is visible.
Yes. So there are some topics which have been selected in last few years, like in 2018, 2017, and like that. And if you get the idea, you will see that there is very common topic, not that much of very much innovative new things which will come in the mind. The whole world will change with this idea, not like that. The research will be simple but very much complete in your sense. Like there is a topic, this is perception and practices regarding noise pollution among traffic police of rural central India. So this has been done in the ENT, we under an ENT assistant professor in 2017, and the student has got selected. Another one is the study of iatrogenic loss of blood in neonates admitted in NICU is very much important. But whatever we are thinking, we are giving stress on a newer thing, but we are not getting whatever happened already in day-to-day practice. We need to focus on that also. You need not to find out something new, but you need to find out whatever happening around you, so that the policy can be changed, so that the new methodology, new kind of application will be given at the administrative point of view. So I am going to give some suggestions on the proposal writing. So first of all, your title should be short, accurate and concise, and should make the central objectives and the variables of the study clear to the reviewer. The introduction part should be rational. There should be rationale behind the work. There should be importance of the study. There should be defending position of the model. You should briefly describe the experimental design and how it accomplished the stated objectives. Describe the situation and clarify the gaps in the existing knowledge. That is the most important thing. What is the gap? Your objective should be specify what kind of knowledge of the study is expected to obtain, and what is to be described, determined, identified, compared, and or confirmed. So in methodology section, I'm giving we both of the today's speaker, we are giving emphasis on that part again, because this need more attention from your side as well as your guides opinion. This may include the type of the study, study design, study population, sample size and selection criteria, proposed intervention, if any, data collection procedures and instruments used, quality control, confidentiality, plan of analysis, ethical considerations with all required forms. If you all want to get the idea of everything, that is what do you mean by the type of study, what do you mean by the study design, what are the study population, you should go through the book, whatever Dr. Parag has said. But if you want to focus on what are the topics, what are the points you need to focus, this is your guide. That the type of the study, design, population, sample size and selection criteria, proposed intervention, data collection procedure, quality control, confidentiality, plan of analysis or statistical tools, and ethical consideration. Now, your last part, last but not the least, the implications that describes what is expected or to be achieved or gained from the proposed research work. You are the researcher, you are going to find out something which is new or which is already there, but you are going to find out the exact scenario. So you know what is the implication of the study, and then you have to give the reference in a proper Vancouver style. This is another most important thing. This is actually a good practice in future also, when you will be a good clinician, when you will be a good researcher, when you will be good academician, academician, you will get this kind of knowledge, like whatever you are giving in reference should be according to your Vancouver style. So with this, I just want to mention that whatever the point that will give you the negative score, that you should also consider. That is, proposal has been copy pasted or plagiarized, or already I have mentioned. The identifying information revealed, like name, contact information of the guide, the student, should not be given. Only you can give your medical college's name in the title part. That is enough. Work already completed or proposal prepared in the past tense should not be given. Research is not feasible. That is, I have already mentioned, this time frame is 2 months only in a medical college setting, unlikely to be carried out by the UG people. So these things will be kept in mind, should be kept in mind. And unethical study or work plan should be kept in mind. If there is any kind of unethical things which you will not get the ethical clearance further, but you have already submitted the proposal, this will not get any kind of support or help. So these are the my suggestions for your uh, part. I just want to mention that already Venkatesh has said that I have already selected for 4 times, consecutive times for STS. And if I will want to find out my first topic, that was completely different from my current, that time my year, that is my second year. When I am going to study, which I was going to study, like pathology, pharmacology, microbiology, and forensic medicines. In that time, I am going to get some study which is related to biochemistry as well as psychiatry. So there is assessment of stress and related albuminuria in caregivers of severely mentally ill persons. So I approached my biochemistry teacher, who was very much helpful in all aspects, but I was clueless that how can we get that this albuminuria and stress like proteinuria, how can we correlate it? Where can I find the patient? I can find the patients like that. And my that teacher, that is already, he is also in the article, that is Dr. Indranil Chakraborty, Professor Dr. Indranil Chakraborty. He guided me to contact another person. He is another professor in psychiatry, Dr. Prathama Guha. She helped me, and she was the ultimate guide of my study, and to frame the study, to help to get the information from the patients, and to finalize the ultimate proposal, as well as the ultimate plan, ultimate research article. So this is the article which actually been selected by ICMR for the STS studentship, and it was been submitted. It has been submitted in your ICMR journal, which is a very much uh, that time as a high impact factor, that is IGMR, Indian Journal of Medical Research, and there is a part called Student IGMR in the year of 2014. It took 2 years to get selection. After submission, it took 2 years to get selected through this IGMR. So for research, why I am giving you this kind of example, because in for almost 80% of you will face similar kind of experience like me. First of all, you will get no clue where you should start. You will get no clue where we will get proceed, and then you will not get the clue that after your research have been selected, what you will do further. So this is the guide, this is the actually whatever I have earned through that ICMR STS first time, that made me actually more confident to apply further or subsequent times. And that actually uh, in the future, I'm just giving you a simple instances. In future, when the juniors who are getting the entrance in the first or second year, they are getting to me to get the idea regarding the STS. Not, they are not going to the senior faculties like that. So whatever I will guide them because I was at that time at like that, like those people who are getting confused, who are getting the topic, were actually struggling with the STS, but they are intended to do. I was helping them like that, that what will be your first step and how you can approach or proceed further to get the estimate STS, and to get the name of the STS award winner along with your name. So that's all. So I hope with our these discussions you can get whatever we have, whatever we want to give you, the whatever we want to emphasize, that uh, what does STS mean, along with what are the steps to overcome to get the STS projects, STS uh, your funding, your certification, the steps, the actual the road or path to get this, the journey to get this, we have already discussed thoroughly.